The opioid epidemic is a major medical challenge in the United States, with millions of people affected. But did you know that a simple deficiency in vitamin D may be contributing to this crisis? Recent studies have shown that there is an increased prevalence of vitamin D deficiency in patients with opioid use disorder and a dose-dependent association between vitamin D levels and self-reported opioid use. So how does this work? Well, deficiencies in vitamin D signaling can amplify exogenous opioid responses, which may contribute to opioid addiction. Similarly, physiologic endogenous opioid analgesia and reward responses triggered by UV radiation are repressed by vitamin D signaling. This suggests that a feedback loop exists whereby vitamin D deficiency produces increased UV endorphin-seeking behavior until vitamin D levels are restored by cutaneous vitamin D synthesis. So what does this actually mean? Our bodies need vitamin D to work properly. If we don't have enough vitamin D, it can make us more sensitive to drugs like opioids, which can lead to addiction. Vitamin D also plays a role in our body's natural pain-relieving system, and when we don't have enough of it, it can make it harder for us to feel better when we're in pain. Sunlight triggers the production of vitamin D in our skin, and it's possible that when we crave sunlight, it's because our bodies are trying to get more vitamin D. So, when we don't have enough vitamin D, our bodies may crave things that can give us endorphins, like UV radiation, until we can make more vitamin D. But here's the thing, while UV exposure leads to vitamin D synthesis and its opioid suppressive effects, exogenous opioid use is not followed by vitamin D synthesis. This can contribute to a maladaptive addictive behavior cycle. These findings have important implications for the treatment and prevention of opioid addiction. Identifying and addressing vitamin D deficiencies in patients with opioid use disorder may be a key step in mitigating this crisis. So what can we do? Well, it's important to get enough vitamin D through diet or supplements, and to make sure we get enough exposure to sunlight. It's also important to address the underlying causes of opioid addiction, such as trauma and socioeconomic factors. The opioid epidemic is a complex issue, but by understanding the role of vitamin D in opioid addiction, we can take steps towards a solution. If you enjoyed this video, you'll be sure to enjoy this one. Also, be sure to like, subscribe, and turn on notifications so you get notified when I release a new video. Be sure to check out some of the recipes on my channel as well.